Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another interesting woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
My name is Becca. I am in Wisconsin in the U.S. I was born near one of the Great Lakes, which is kind of fun. I'm from the Midwest. And my story starts when I was in nursing school. I went to school to be a nurse, and I thought I wanted to help people, and that was the way I decided to do it. And as I got into the healthcare system more and more, I just realized that we were giving people pills and surgeries and not really giving them answers to their health. And as I went through nursing school and shortly after, I got married myself, and a lot of friends around my age, both in nursing school and personal friends, seemed to be struggling with fertility, even though they were what I would call young and healthy. And I graduated nursing school. I had my first child who ended up having food allergies and eczema. And one of my clients where I was working at the time at the hospital actually introduced me to the whole concept of nutrition, because I didn't really know that food had such a huge impact on our bodies and how well we do and how we function and diseases and illnesses. And so I ended up taking her to a nutritionist with great results. And the further I got into healthcare, I realized that we weren't teaching people this. And I wanted to learn this for myself and my family. So I went back to school and got certified in functional nutrition. And as I got out of school, I started kind of just helping everybody. But there came a point in time where one of my friends, she was a bit younger than me, but she's like, Becca, I know you help with a lot of things, but we are struggling getting pregnant. And do you think you could help with that? And I'm like, I actually don't know, but let's give it a try. And it's always interesting to me that whenever I help a couple with fertility, that kind of along with that comes some other issues, typically things like anxiety, insomnia, ADHD, a lot of different things depending on the client. They are struggling with these other things. And so with her in particular, she was really struggling with anxiety. And in her particular case, she wanted to avoid medication. And I was like, well, let's work on your diet and do some supplementation, and we'll see how far we can get. And 3 to 4 months later, she called me and she's like, Becca, we're actually expecting, which was amazing. Such a quick turnaround. And doing an interview with her after we'd worked together, she's like, she had told me that her anxiety was roughly 90% better in just a short 3-month period. And I talked to this client recently. It was interesting. She had one baby, so this was a case of secondary infertility. And with her first child, she had gestational diabetes. And the interesting thing is that when someone has gestational diabetes in a pregnancy, they are way more likely to have it in subsequent pregnancies. And she did not this time around. And this was in 2020. I spoke to her recently, and she actually just had her third baby since we've worked together, and all of them have been born healthy, full-term babies and no gestational diabetes. And I just grew really passionate about teaching couples about what I wish I would have known could possibly impact my children before I got pregnant and while I was pregnant. And I feel like at least in our culture in the US, that's something that is very lacking, that typically was taught in traditional cultures, how to eat and prepare the body for pregnancy. And there's even some traditional cultures that limit when their couples get married so that their babies were born when food was plentiful and when milk was on, like, the cows were eating fresh green grass and there was all these nutrients. And so I'm just really passionate about helping couples set that foundation, and especially if they're struggling. And now working with more and more couples, I see where the medical field a lot of times is overlooking things that could be done, or even basic steps that I think would be taking place before we get to the point of doing medical procedures. So like I said, I'm a wife and I'm also a mom. My oldest child now is 14, and I've been working on my own health journey ever since, but I'm very, very passionate about helping couples get pregnant and then start their life off on the right foot as far as health and nutrition goes.
Fantastic. Becca, it sounds like you have your work cut out for you. Infertility can be a challenge for a lot of women. Now, what does faithful infertility mean to you?
So I am a Jesus girl, and faith is to my heart. And I feel like when we go through trials, our faith, it strengthens us or it becomes something that separates us from God. And so I really want to help pull couples back in and encourage them in their walk of faith while they're walking through this struggle as well.
That is awesome. How did your own fertility experience shape the work that you do today?
That's a good question. I did not struggle with fertility, but my sister did, my best friend did. And so I guess it was more walking alongside other women and just seeing the hurt and pain. And motherhood was something that kind of surprised me, and the fact that I didn't think I would have children. I didn't want children growing up. I wasn't one of those women who couldn't wait to get married and start a family. But my first baby was a surprise. And then when I had her, it was just kind of that gift from God that I didn't even know I needed or wanted in my life. And I loved being a mom, and I wanted to help others achieve that calling and fulfill that. There's just such a maternal longing in a lot of women to have children. And so I really walking alongside women who had walked through that and walking closely with them, I really wanted to help them with that.
That is just awesome. Now, why do you believe so many women are steering quickly towards IVF or surgery without deeper exploration?
I think it's a number of things. The first thing is, I think it's a moneymaker for the medical industry. IVF is a very expensive procedure, and unfortunately, that's what our physicians are trained in, is medications and surgeries. They aren't really trained in nutrition or how to balance out the body or look for nutritional deficiencies or heavy metal toxicities or other things that might be interfering with that fertility journey. And so it's one of those things where I think it's both that they don't know any better, and also it is a moneymaker for the industry. And unfortunately, when you dig deep into the industry, a lot of those drive the decisions that are made. And I talked to a mom recently who told me that she did not want to do IVF, and she just felt so pressured by the doctor that day and into making that decision that she didn't even feel comfortable making, and she regretted it afterwards. That's such an individual journey. That's just one woman's example, of course, but I do think that a lot of times people just are pressured into it, and they don't know that there's other options out there that can really help them without going that route, if that's what they wish to do.
Yeah. Wow. Now, what are some of the first steps that a woman can undertake to understand her cycle and fertility naturally?
There is a great book, I think it's by Lisa Hendrickson Jack. It's called The Fifth Vital Sign. And this has been the best book by far I've read about a woman's cycle. And I love her perspective on it because she does talk about how to eat well for your cycle, about whole health food. She talks about the different phases of the cycle and just very intricate details, even about cervical fluid and things like that, that at least for me and for most of my friends, we were never taught those kinds of things growing up.
Yeah.
So a lot of women just don't even understand fully how their body works. And it's hard to work with your body when you don't even understand completely how it works. So that would be my first recommendation for any woman. And there is great dietary advice in there. There is great advice on just how to chart your cycle, how to track your cycle, what to look for, what's normal, what's not normal, things that really should be taught in a middle school health class.
Oh, Becca, I am hearing a sound in the background. I don't know if you can hear.
It is raining here.
Is that the rain?
It is the
Go
rain.
go into your settings and let's block out the background sound. Go into the audio because I really want the quality of your audio to be clear. Go into settings and audio and tick the echo cancellation and reduce the mic background sound. Let's see if that improves things.
The echo cancellation is on, and then the reduced mic background noise is on too.
They're both on. Oh, that's interesting. All right, let me just test something quickly. Give me a second. Because I love the audio to be really nice and crisp and clear. Now, say something. Say something.
Would it help if I put on headphones? The echo cancellation is on, and then the reduced mic background noise is on too.
Okay, no, we're good. We're good. I'm just listening to the live recording online. It's not as bad as I thought. Thank you for doing that for me.
That's okay. I can throw in headphones too if you think that would help.
No, it sounds okay. I had some technology issues yesterday, so I'm just wanting to make sure that we're broadcasting a nice, clean sound. All right, so how do you integrate Christian faith into your fertility coaching and resources?
That's a great question too. I really am supportive, first of all, of marriage because God instituted marriage and children are a gift of marriage. And so encouraging couples in their marriage, first of all, and then each week there's kind of a devotional that goes along with the fertility lessons. I try to do a faith-based lesson, a mindset lesson, and then a lifestyle lesson each and every week for 6 months. And so more than anything, I want to encourage couples in their faith and help them to draw near to God because it's such a difficult time. And like I said earlier, our trials either they can strengthen us or they can really cause us to question our faith or even other relationships in our lives. And even amongst couples that struggle with infertility, the divorce rate is much higher as well. So I guess I feel like God gave me my gifts, and it's a very unique aspect because I have not seen another faith-based fertility coaching program out there. But in talking to so many women, it's something that there's definitely a need for.
Yeah. So what are some of the misconceptions that people have about natural fertility?
I think probably the biggest one is not understanding that diet can make such a huge difference. And every single thing we eat and put in our mouths either helps our health or hinders our health. And most of us just weren't taught well how to eat. Like we don't know how to nourish our bodies. Or for instance, it was a couple generations ago that and maybe it is in different cultures too. I know some different cultures are better about this, but things such as eating organ meats are very, very nutritious and very nourishing, or drinking raw dairy and things like that, that at least in our country have been frowned upon, or we've moved past that. But there's so much nourishment and so many vitamins and minerals and organ meats would have been prized in cultures not that long ago. Um,
Yes.
but nourishing your body and making sure that you're eating good foods rather than what I like to call food like product. So many of our foods are processed, they're made in a factory, they're made with chemicals and dyes and just ingredients that are doing our bodies no favors at all. And so, if we can eat foods the closest to nature as possible and make sure that we're also eating nutrient dense foods like organ meats, like raw dairy, like vegetables and fruits and all these things that, at least in the standard American diet, are very lacking.
Yes. Yeah, that is so true. It's really almost going back to the old way of eating food as well, right?
Yes, exactly. Traditional ways of eating food are definitely more nourishing, and you know, they would have had bone broth. They use the animal from nose to tail, and we very much don't do that. And in some ways there are some movements and some pockets that, like the paleo movement brought about a lot of good changes, I would say. And there is a push for organic foods and less processed foods, but we still have a very long way to go.
Yeah. Now, how do you support your clients emotionally and spiritually during their journey?
Emotionally, I most of my clients have text access to me, and I'm asking weekly along with that what I can be praying about for them, and I pray over my clients at each and every appointment too. So emotionally, I try to be there for them, be their cheerleader, be their bestie in their back pocket, I like to call it, because they can text me or voice message me anytime they're struggling, whether it's emotionally or with food choices or whatever it is. And then spiritually, I'm they're getting a weekly devotional, and I'm praying over them at every appointment, and I'm there to help them with whatever they need from me during that time I'm working with them.
That's just amazing. Now, tell us about a transformational story from one of your clients that deeply moved you.
Yeah, there was a client recently who, she came to me and she was like, I don't know if you can even help me. And she had been told that she was going to be on medication for the rest of her life. And she didn't want to do that. And again, that's a very personal choice, but she did want to look into other options. And she was one who was also struggling with severe anxiety, panic attacks, and she just felt, she used the term lost herself. And it's always interesting to me to see how women perceive themselves, especially after they have children, because we do kind of lose ourselves in our children. And she in particular, though, she was struggling with heartburn every day, like severe heartburn. And we started working together. And about 3 months in, I checked in and I was like, how are you doing? And she's like, oh, I'm getting there. I'm doing a little better. But I talked to her the other day, and she just went on and on about just the change in her life. She's not on medication. She's not on any special type of diet or anything anymore.
Mhm.
She's not dealing with anxiety or panic attacks anymore. And her husband piped up and he's like, I feel like I have my wife back.
Oh,
And
wow.
it's just so moving to me. It's such rewarding work, because I'm not just working with someone to change their health. I'm in essence changing their life. And
Yeah,
she's going to be a better wife. She's going to be a better mom to her children. And you can't put a price tag on that, you know?
yeah, that whole lifestyle change is just profound. And now let's talk about the role of nutrition and lifestyle towards fertility. How does it impact having this holistic perspective to fertility?
Yeah, our modern lifestyle is really working against us, unfortunately. And from everything from light bulbs to
Mhm.
being indoors all day, every day. And if you once you really start to see how much our culture has changed over the last really 150 years ago, since the Industrial Revolution, where we can stay up past midnight because we have lights, and now we have phones in our back pockets that emit blue light, which suppresses melatonin. So we're not getting sleep and we're not getting those hormone regulating cues because we're not getting outside. We're indoors all day under fluorescent lights. So there's so many things that we as a society do that really are working against us. And so the more we can feed our bodies those traditional foods that are nourishing to us, and whether you live on the coast or inland, there were foods that people ate specifically to nourish egg and sperm production because they're such tiny, fragile cells. But even getting outside in the morning when the sun is like less than 30 degrees in the sky, it tells your body it's time to wake up, and your body emits cortisol. And what happens is that they're running around kind of like a chicken with their head cut off. They're running from one thing to the next, and they're on caffeine, and then they grab a donut at 10 o'clock and their blood sugar spikes. And both blood sugar and cortisol are what are called master hormones. So they have a huge impact on testosterone, estrogen, and progesterone. And so if we don't get those things handled, we're going to have irregular cycles. Your cycles are going to be painful. You might not be ovulating. And then on the other side of it, even in the holistic space, I feel like men are a very overlooked piece of the puzzle, and that the focus is on women. And men are 50% of the equation. It takes two to tango. But sperm production and sperm quality have gone down exponentially since about 1940. So what was considered borderline fertile roughly 50, 60 years ago is now considered normal. And couples are wondering why they're struggling to get pregnant, or, why it's taking so long. And it's because sperm is not only at a low rate, but the quality of it. And if you look at it under a microscope, it's rather fascinating. Many sperm are very deformed. They don't swim well, things like that. But what is considered normal in the medical field is not optimal for getting pregnant. So the more we can, and it's just as important for men to be outdoors, to feel the grass beneath their feet, to have fresh air, to be drinking clean water. Like all of these things contribute to how well those tiniest, most fragile of cells are going to function. And if your body is just struggling to barely get by because you're running on things like sugar and caffeine, it's going to put reproduction on the back burner, because you don't have to reproduce to live, but you do have to get through the day. And so say we don't have the energy to do that, because it takes a lot of energy to make a baby and then grow that baby for 9 months, or even make, in the case of a man, healthy sperm. But if his body or her body is busy putting out fires all over because we're doing all these other things and not taking care of our bodies and not eating well, then reproduction is like out the window. We don't need that to survive. So.
Oh, man. Now, you're moving away from social media towards evergreen content. Why is that?
There's a couple of reasons. First of all, social media is such a hamster wheel. And if you're not creating content consistently, you are not relevant. And even people who do create content consistently, their content is not typically seen by their followers. And to me, I would much rather spend time. Yes, I want to make content, but I don't want to be on this content hamster wheel. The other reason is I feel on social media, there's these knee-jerk reactions, I like to call them, and people just kind of say whatever they want, and they take things out of context, or they're like, well, that didn't work for blah, 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 without really listening to, the whole message. Or they see like one post of yours and without realizing the context of where you're coming from and your philosophies and everything. And to me, I don't like that. And I like to foster true connection with people rather than trying to look for, going viral. So I feel my time is much better spent making content that will be relevant for a very long time, rather than content that is going to disappear in 36 hours and be viewed very critically by, every Tom, Dick, and Jane that comes by and just sees it.
So what are your thoughts on balancing faith with medical information?
I think that medicine, to an extent, is a gift from God. However, at least in the US, I feel like chronic disease is not cared for well. And if you go to the doctor with a chronic illness, typically they're going to offer you either medications, which usually come with side effects, or surgery.
Right.
And for most people, they would be much better off eating well and drinking well. They're going to go much further. In emergency medicine, I think the medical field is amazing and can save lives. But there's such a balance between how God intended us to live and are we taking care of our bodies? Are we seeing our bodies as the temple that God created them to be? Or are we just looking for a quick fix? And one of the fruits of the spirit is self-control. And a lot of people would do well to implement a bit more discipline in their lives in the areas of movement and eating.
Right.
And like I mentioned earlier, I think God gave us everything on this earth that we need. And the closer we eat foods to nature, they come packaged to readily absorb rather than when you take big doses of nutrients, your body usually can't absorb them like a huge dose of, vitamin C or something like that. Your body can't absorb all that because there's not all these cofactors like you would find in orange to properly absorb it. And
Yes.
so there definitely is a balance there, and that's such a it's such a personal choice, and
Right.
it depends a lot on somebody's perspective and what they have access to. There are some great doctors out there, and there are some terrible doctors out there, and there are some great nutritionists out there, and there are some terrible nutritionists out there. So
Mhm.
I always like to intermingle faith by praying that God will bring me the right clients at the right time. And I hope that they're praying that they will find the right provider. And if that's me, then yes, I want to work with them. If it's someone else, I want them to work with that provider. And there have been times where I'll refer to another provider because I either don't feel like that client's a good fit or I don't feel like I can help them to the extent that I would like to.
So, how do you speak to women who feel broken, discouraged, or ashamed about their fertility struggles?
Mm. I first of all encourage them that God made you a whole beautiful woman before children were ever in the picture. So whether you ever have babies or not, you are completely whole and wanted in the sight of God. And the other thing is too, there are so many stories of infertility in the Bible, and sometimes God answers our prayers how we want them to, and sometimes he doesn't because he has a different path and other things to teach us. And it can be tricky walking that fine line and sometimes encouraging couples to open their minds to other avenues of family, whether that's, you know, egg adopt or embryo adoption or adoption period, just
Yeah.
adopting rather than having their own children. And it's such a personal journey. And I guess I feel like my job is to help give them informed consent, both on the medical side and in the fertility space. And then ultimately, what they do is between them and God. But every woman should know that they are beautiful and whole, whether they have children or not. God didn't make you just to be a vessel for children. He loves you dearly just how you are.
So, what is your long term vision for Faithful Fertility Co. and the women that you serve?
I would love to eventually have a team of nurses who have also decided that they would like to help women in a holistic way. And I would love to be the place that Christian couples come when they're struggling with fertility because they know that they're going to get good care and it's going to be holistic. And the fact that we're doing spiritual, we're doing mental, and we are doing physical care because we are such interconnected beings. And again, I think that's a piece that the medical field often overlooks, and that they throw medications at things without considering the whole person and what kind of an impact that's going to have on their mental health, on their spiritual health, and things like that. but I would love to be the one-stop shop that women come to, and of course bring their husbands when they're struggling with fertility, but then bring their children back to if their children are struggling with something. And really, eventually, I'd love to be a whole family, a faithful family care where we just point people to Jesus while we love on them and help them take care of their bodies.
Fantastic. Well, Becca, thank you so much for coming online and sharing your story with our community today. It's always fascinating for me to be able to connect the women in my community with practitioners who are bringing different modalities for healing, and you do come with a completely different perspective. So thank you for your work.
Thank you so much for having me.
And thank you to everybody who tuned in today. The Her Story Circle is not just a podcast. We're a social impact movement that brings you the stories and voices of women from all over the world. We share our stories to uplift you, inspire you, energize you, educate you, but most importantly, to take you from where you are now to where you're trying to go. So whether it's you who is struggling with a fertility issue or you know another woman who is, now you've got somebody you can reach out to. I will have Becca's details with this podcast, so do find her through social media, get the support that you need. I'll be back again tomorrow, everybody, with yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And Becca, thanks again for the interview. Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making her story.